Hello, Dr. Bafalakis and classmates. My name is Adriana Gillespie, and today I will be presenting my soap note for Adult MSK. My patient is SM and date of birth 2/21/84. She's 41, Indian female who presents to the walk-in clinic by self and appeared to be a reliable historian. Her chief complaint was my lower back and knees hurt. The patient presented with a chief complaint that she had acute pain in her lower back and both knees, and she reported this pain started approximately 2 weeks ago and worsened last night. These pains radiating to her knees to the point that she was unable to go to work today. The patient also reported that the pain started after her new job as a preschool teacher's aide, involving carrying heavy cases and small children of around 30 to 35 pounds. The pain in the lower back is exacerbated by movement, particularly when raising from a seated position or laying position. Her associated symptoms included some nausea that she's had in the past and dizziness. And she denies any fevers and chills at the moment. The patient explained that the pain does get better when she stretches on the floor. She took ibuprofen for 100 milligrams last night, but it only made a small difference with her pain. Okay, she has a past history of motor vehicle accident which hurt her back in 2004 in India. She has had two C-sections with her two sons. She has no allergies, and she currently just taking supplements for vitamin D and B, and the ibuprofen for 400 milligrams as needed. She has no significant family history associated with the MSK. She lives with her husband. Again, she's a preschool teacher's aide. She denies any caffeine consumption. She sleeps well, but lately she has been struggling with sleeping because of her back pain. And she denies any alcohol, tobacco, illicit drugs. And lately her stress has been a little bit high for the last few weeks because of her back pain. The review of system, I'm just going to mention the significant ones. She does report a little bit of dizziness, and she denies any double vision for neurological headaches or seizures, and denies loss of sensation in between her legs in the saddle area, or numbness or tinglings in the inner thighs, legs, or feet. Respiratory, she denies everything. Musculoskeletal, she reports the pain and tenderness in her lower back and bilateral knees. Denies balance problems. Reports pain when standing from seating. Denies recent falls or trauma. And GI and GU, she denies any constipation or diarrhea or any incontinence. And she denies any dysuria or bladder incontinence. Her vital signs were within normal, except her blood pressure that was 137/92. She did mention that her blood pressure is usually a little bit on the lower side, but she was experiencing pain. Her pain was 7 from a 0 to 10 scale. Her physical assessment, her general appearance was she appeared in pain, but she was well fed and focused, but in no distress. Her cardio, neurological, and respiratory were all normal, but her musculoskeletal, her extremity, her gait, even though it was normal, but an upper and lower extremities with no clubbing, swelling, or cyanosis. She had good capillary refill. Her popliteal and dorsalis pedal pulses were normal, +2, but she did have limited flexion, extension, limited rotation to the right, to the left, limited left and right lateralization of her back with pain and discomfort. Her straight leg raise bilateral was only to 50 degrees before she started complaining of pain, so it was limited with expression of pain. Her knees flexion and extension were intact with minor discomfort, but there was no crepitus, no swelling, no tenderness, and there was no Baker's cyst noted behind the knees. The diagnosis of choice that we chose was one, low back pain, second was intervertebral disc disorder, and third was cauda equina syndrome. The one that we mostly suspected is she was having low back pain, and this is usually presenting because of her lifting heavy cases or the children that she's been lifting at work. This condition is a leading cause of disability worldwide, and the presenting symptoms definitely is suspected of this condition. However, if she does continue having more problems, CT and MRI will be definitely considered. The other two diagnoses for now, the intervertebral disc disorder and the cauda equina syndrome, will be ruled out because the patient is not experiencing any tingling or numbness, or she's not, or the x-rays and the ultrasound that she previously had were normal. And we went ahead and treated the patient with diclofenac, 75 milligrams, methocarbamol, 750 milligrams, tramadol, 50 milligrams, and we only asked her to take a few times, 3 to 4 times a day, and physical therapy for the next 4 weeks, 2 to 3 times a week. Her restrictions were for sure to stop any strenuous physical activity for the next 2 weeks, and we gave her a note for her to have for light duty to present at work to not lift any more than 10 pounds so she doesn't exacerbate her back pain. Stretching, using ice for inflammation, and gradually introducing physical activities after 2 to 3 weeks. The patient is in need to return if the symptoms worsen, so we could do a CT and MRI, or if they worsen where she's unable to walk, or she has numbness or tinglings, or any loss of bowel or bladder, she needs to call 911 immediately or head to the ER. My reference will be attached. Thank you.